panel discussion titled Nordic Innovation and Global Investments. Those are big words, and also sounds like quite a broad topic. But what we're here to discuss mainly is what sets Nordic growth stage companies within biotech, pharma, and medtech apart in a global setting. And what do they need to do and to prepare for in order to strike more and bigger deals? And what preparations can they make to attract international venture capital? With me here today to discuss these pressing matters our distinguished panel. We have Pieter van der Meijden, representing the DNB Healthcare office in Stockholm. We have Balendran, senior. Oh, I have to read this one. This is a long one. Senior licensing director of global business development from Novo Nordisk. Welcome. And last but not least, we have Søren Lemonius, who is managing partner and founder of the Sunstone Life Science Ventures. So I'm going to start with perhaps the toughest question to answer right away, and you can all feel free to dig in. Given the high quality science that we are known for in the Nordics, why aren't more big deals being made involving Nordic life science companies? And I know that there was a deal announced fairly recently involving a Nordic company, but never mind that. So what do you think, Pieter? Is there a simple answer to this question?
Simple answer. Well, I think that reminds me a little bit of what a investor told me some years ago, where he said, it's funny, these Swedish companies, they invest 100 million in product development, yet then they forget to invest an additional 100 million in sales and BD, because that's often seen as something, is that really needed if we have developed, such an amazing product? And I think in general, what we see, and it's not just on the BD side, but also investor relations side, there should be a little bit more respect for that particular aspect, as seeing it as a sales function. And what I mean with that is, to give an example, when I was a student and I had a job selling ad space, you had a list of 1,000 companies, and then you need to convert 10 of them. It's like, oh, only 10? Well, it might be a shock, but the people at the other end of the line, they're not really waiting for you to call them. And I think that with pharma, you're looking at hundreds of opportunities, investors, like Sunstone. I mean, there's so many private companies, and then alone in the US, there's 700 listed biotech companies. Then here in the Nordics, there's additional 200. In Europe, there's an additional 150. So also specialist investors that we speak to, they say, you know what? We don't really have time to look at all of them. So it's also a little bit the basics of sales, cold calling, using a CRM, following up, and really seeing it as that kind of an activity that needs to be done.
So in short, what you're saying is that the Nordic companies are a bit lazy.
I think not lazy. Thank you for that, by the way. I think that they maybe not always dare to be as forward-going as maybe the American colleagues, where they pick up the phone and they get the other person, they try to get them through the telephone, to tell them all about the product that they've worked on so hard. And really being a little bit more outgoing and really looking at it as, sales one-on-one. Okay, sales one-on-one, how do we do this? Okay, long list, we start here, we follow up, etc., and being a little bit more outgoing in that respect.
Anu, being on the side of things where you have to do the hard work of picking projects, is that your impression as well, that is there too much of a if we build it they will come mentality and not enough aggression going on in the outreach?
I mean, following on from Pieter and to your point, yeah, I mean, you can sit on it. The fact is not they will come, they don't know about it. That's really the point. So you have to take that step of making sure that your potential partners know about it. So this is really important, that you just can't say, oh, I'll just put all my money into the technical part. And normally it's scientists leading the companies maybe, and they're really interested in spending their money there and not thinking about getting the message out, marketing it properly, creating the network and getting to the right people. You know, you can do all that by yourself, and nobody knows about it. So this part is important, that you also invest into the BD part to make sure that they know about it. So yeah, it really is a key thing that a lot of companies that are focused on science first a bit too much and forget the business really suffer. Yeah.
So Søren, at Sunstone, you invest in companies. You have also a great influx of companies that would like you to invest in them. When you assess these companies, do you take special notice into the fact, did they prioritize their assets also towards BD, or is that something you feel that you want to help them with?
So that was several questions, right, on top of the initial questions.
I am a pro, yes.
So let me, I just want to go back to the original question of why are we doing that bad on translation of science into companies? Because it's the wrong, I mean, we're not, we're doing very well. On a Nordic perspective, I mean, we're forming more companies, we're having more seed financings, we're having more Serie A relative to our European peers. The only other region that does any better than us is probably the UK. So we're actually doing really well in the Nordics. So just kudos to all of you for doing that. And then I think, but that said, of course, I mean, relative to the US, I think McKinsey analyzed and says it's about 1 to 3, right? So we can, in Europe, do a lot better. Long discussion, how do we get there? Then to the sort of follow-up questions, once they have then, because we see companies, we don't see projects, right? You typically need to have formed a company, have some IP, maybe have had your first sort of angel funding before you become relevant to us. And then does it, how much BD do you need to have done and what type of BD plan? It's not too important to us. I would say to us it's more whether the type of innovation that you're working on is relevant for BD, I would say, and has the generics of what we think can create early tractions. I mean, some things are easier to get in a dialogue with a pharma company about than other stuff, right? So those are the things we're looking for, and then we'll help with the BD part of it.
So then, for any relationship, there has to be some type of initial attraction going on. So what do you need to do then as a small bio or medtech company to immediately catch the eye of, for example, a big pharma or a top-tier investor? What would you say is there a secret sauce, Anu?
I don't know if there's a secret sauce, but I think one of the things that's important is, you know, you need to put the effort into finding out who you're going to go after. So first, so it does take the effort to understand what does the big pharma partners want. So think about it, even when you start a project, you might be excited about, but is there actually a market for it? You know, you might think there's a patient population, there indication, but also make sure that the pharma companies are considering a treatment modality regimen that you're developing as a potential future product. So you keep in mind that you have a customer there for partnering. So identify them first. You know, so you're approaching a company that actually wants what you have. And I do get this, like a neurology company, oh, Novo Nordisk, oh, you're a big pharma. So, hey, are you interested in a neurology product? No. Why would you even ask me? You know, because we don't do neurology. So understand who you're going, and then try and, you know, you need to build the relationship over a while. Make sure when you're early, you're reaching out, you're educating your potential partners, keeping them informed of progress. The sweet spot you think you want to partner might not be where they want to partner. They want to partner at a different time point. You need to understand that. So it takes that kind of effort, really building on Pieter, to make sure that you are putting that, you know, kind of time into building that relationship.
Yeah, sort of basic research needs to be done before you approach either an investor or a big pharma company. But then having done perhaps that first initial basic hygiene factors all cleared, we know that our project is in the right field and perhaps in the right phase and so on. But still, there are probably quite a few other projects out there. So what can you do in order to stand out? Can you do something crazy, come in with a hat with a turkey on it, or
you might get noticed for the wrong reasons. It's really the quality. And I guess there's no generic rule about it, but you have to stand out from the competition. So to understand what else is there and why you differentiate, and making sure that you show that differentiation data, you kind of put effort into creating that data and then presenting it in a very succinct manner is important for you to really stand out of the crowd. You're right. I mean, nobody's going to give you any extra attention because you're Nordic. I think all the pharma companies are looking across the world for projects. So you just need to compete globally from day one. So keep that in mind, and then keep a sight of your competition and understand how you're differentiating. And if you're not, maybe it's even best that you don't move forward if you don't have a differentiation profile for your particular product compared to what's out there.
So the question about how do we set ourselves apart as Nordics, I can throw that away. Pieter, when you work with companies and if you advise companies, for example, how would you give them concrete advice as to how to sort of stand out in the crowd or break through the noise, really?
Well, it's very much what was just said about understanding your market, and it reminds me of an interaction we had we were on a roadshow with a Swedish company, meeting a specialist investor, and the first 4 or 5 slides were about market size. And very early on, this investor just cuts off the CEO of the company like, I'm sure it's huge. Let's move on. And it was really about where does this idea come from? Why? Who are you going after? And explain how you think you're different, but also very much be open to the idea of not going it alone. And this comes a little bit back to also the financing market we've seen over the last 10 years, where financing was so easy that everybody just wanted to finance themselves all the way through to the end of phase 2, because otherwise it's seen as giving it away. If we partner too early, we give it away. So be open to that also, because partnering early will have maybe benefits of working with a partner that has a lot more experience and resources of how to set up a certain study design for a certain indication. We've seen plenty of Swedish companies, unfortunately, going at it themselves, and then, phase 2 is a complete disaster. Study design was maybe not as it should have been, because maybe the knowledge was not in-house. So be open to partnering earlier on to get that help. And I mean, the funny thing is, I think Sweden's largest company and biggest success, BioArctic, I mean, they partnered preclinical, obviously very unique case in many ways, but be open to that and not just think about, okay, we're meeting investors, give us your money. We're going to pitch what we're selling.
Is that what you experience? So they come in and say, invest in us, give us your money. We can do the rest ourselves. I mean, you are an active investor.
No, I don't think that. Also because they come. I think we have a lot of good entrepreneurs with a good understanding of the core of the core innovation that they control, that they have developed, right. And I think, I mean, my advice would, don't go talk to him if you have something for Novo Nordisk as the first person. I think the best advice you heard today was from this Cornerstone presentation. You need to look at their clinical advisors. You need to find, because if you have an early innovation, then you're basically selling it into R&D. You're not selling it into business development, right? They're the gatekeepers. They're these people they put in front of R&D to keep you out. You want to find some links into R&D, some alliances you can make, and that goes through the independent clinical advisors they're using. you need to find them. If you have something you think is relevant for Novo Nordisk, for instance, right? If you have something in obesity, find out who are the clinical advisors they're working with. Next, then you go and find out what are they actually doing. I mean, you want to understand their business when you go and see them. You want to understand their products, because then you understand their needs. And just by being credible about understanding them is going to increase their belief in you having an interesting innovation. I mean, you understand what you need to meet to be of relevance and interest to them. And then you can go and talk to them at that time. I think that's part of also what we try to bring to this understanding, help our investments with understanding that when you come to us, it's really about that. Do you have an innovation that we believe that can be worked up to this? And I think that's where it starts. I mean, there simply are some innovations that are true innovations, but where they don't lend themselves to early business development or early partnering. And then as you point out, then maybe you shouldn't be doing it, which is of course a hard call to make yourself.
So, Anu, I don't know if you want to respond to that.
Yeah, I mean, I take Søren's point, and there is a concept of understanding what is the pharma company looking for, their interests, maybe getting to the right scientific person for earlier programs, so that you have a champion within the company. And if you can achieve that, then you have somebody within the company fighting for your corner, and that is so difficult to find in a pharma company, you know. So if you put the effort, I mean, this goes from your BD effort is not just turning up at bio partnering meetings and having, you need to do that contact with their BD as well, so that they are aware of it. They can, you know, sometimes a BD person could be very scientific, and a lot of my colleagues are. So you might find the champion in them, and you know, I've championed stuff internally. So you have to reach out to the different people. You need to connect and make sure that they are getting excited about your science, right? And so you reach out to the scientific part. So make sure your BD campaigns also involve all the scientific meetings, making sure your scientists out there presenting posters are connecting with the pharma scientists who come and read their posters or their talks, you know. Keep that connection. Make sure that you educate them. So there are people who truly understand what you're bringing out over time, so that when you're ready, there's several people saying, yeah, this is exciting. We've been talking to these guys. That's what makes a difference.
And that leads into the point of being persistent, being active, reaching out to then several different layers within the other organization, I guess. So, but if you are a small company and you're fortunate enough to have, you know, gauge that initial interest, which key factors do you need to consider when you, as a company, then evaluate your potential partner? What do you think, Pieter?
Well, it's maybe from an investor point of view. Especially if you have companies that are either still private or looking to go public, then in the past there was always this discussion of, well, we're also talking to some VC firms, but they're not willing to give us the valuation that we're looking for, and they want a large chunk of the equity, and they have other things that they want to have, and if we go to the stock market, maybe we can just get more bang for our buck. But I think you need to look at what else is that partner bringing to the table. And I think if you go with investors like a Sunstone and others, it's so much more than just money. And I think now that the market has been so tough over the last 4 years, I think a lot of companies have realized that if you have strong partners in terms of investors that are really partnered with you and want to see this through, that really brings so much in terms of not just money that they bring and additional rounds that they can sponsor, but also advising you on what path to go and maybe also when not to go down a certain road. So I think it's really important to think about what else do they bring than just money.
So the question is then, Søren, what else do you bring? No, it's a serious question. What do you feel is the best thing apart from the financing that Sunstone can provide?
I think, I mean, hopefully also by now, a good network across the industry, right? And I think and access to people. I think also a good understanding of what it is being a biotech entrepreneur, that it's not a straight line. We also bring, of course, you could say, additional financing, right? We understand that, yes, we put down a plan that reaches 4 years into the future, and we put financing into getting there, but very frequently, if ever, that is the way it goes. And we know that, and we understand that. I think maybe, I mean, this is part of the dilemma you face if you go on a public market, right? I think we have probably a better and more nuanced understanding of it not being a straight line, although that very naturally our money comes at a higher cost. I think it's more expensive. I mean, yes, we probably do take a bigger owner share, right? But we probably also have a bit more patience, and we will be ready to finance subsequently, which can be some of a struggle if you're a listed company and you did not meet that phase 1 or 2 or whatever it was. So I think that's part of what we and some of my other colleagues bring into these companies.
I was going to ask you, Anu, we heard in an earlier panel that as a big pharma, then sometimes you see projects, and you were touching upon this, Pieter, that the clinical trials might not have been optimized perfectly and so on. How allergic are you at Novo Nordisk, for example, to that? Are you very understanding and forgiving when it comes to those things?
As a biotech, you probably want to get to the inflection point faster. So I think that's understood. So you might not do a pharma quality trial with all the parameters measured, co-developing diagnostic kits and so forth. So we take it. But what that means is that you might think, oh, I'll just go into the phase 2 now. But to be honest, no, we need to run this trial again. So the important part is you've got data. So you actually produce that human data that there is efficacy. So you've achieved something. So of course that is appreciated. However, maybe it's not as advanced as you think it is. There will be a need to repeat or maybe have a more extensive next trial. So it does delay the timeline. So there's going to be a difference in your timeline to launch versus what the pharma company will put down. So I think you need to, I wouldn't say you need to always run a pharma quality trial. You need to optimize your cash flow situation to what you can, but try as much as you can to build it. And I have, on that point is, now if you look at some of the pharma, biotechs in the US who can raise tons of money, they've got rounds of money, $500–600 million in their bank accounts. They are, some of the licensing deals we've done, acquisition, that when you go in and look at the DD in those companies and look at the trials they're running, those trials are as good as the trials we would have run. So they've got, ex-pharma employees working for them, all the expertise, and they're doing the full bang. So on a global basis, you need to go big. You need to be able to do those to compete with maybe US biotechs are able to raise much more cash, and even Chinese biotechs, right? So it's a changing environment, So the quality of clinical trials run is increasing.
So that may or may not be disheartening to a few, perhaps, companies that are represented in the audience, knowing that you should preferably have $500 or $600 million to run perfect clinical trials and so on. But in China,
can I give you a comment on that?
Sorry, yeah, of course.
So, I mean, that is correct, that the amount of money being invested in biotech isn't going up. But strangely enough, the stage at which the deals get done is getting earlier and earlier, right? So basically, we're in this interesting dilemma that a lot of more money is getting pushed in, but over the past 10 years, we're seeing more and more early deals. Right now, the split for the past 3 years is that 50% of all M&As have been before phase 2. So they're phase 1 or preclinical M&As. And I mean, if you followed the press recently, I mean, Forbion have done 2 very recent, our colleagues in Holland have done 2 very recent big deals, both phase 1 deals. So yes, that could be the case, but it's not being followed by the deals now. So don't go too disheartened. There's still plenty of opportunity to sell innovations while it's still preclinically.
Thank you so much for bringing the hope back. But still, as there are challenging times right now for many companies, and if you're not lucky enough to have a strong partner or an investor owner with deep pockets, then maybe I should turn to the banker and ask, are there any nice, creative, alternative strategies to secure funding to be able to create this data that is so important to get forward?
Well, we
have a loan.
Exactly, at DNB we do loans, so that's true. But now we spoke about this last year, I think, when the market was a lot more grim than what it is now. Alternative financing structures, whether it be convertibles, other types of funding that we see, that you have companies financing particular studies, etc. Yeah, we've talked about it, partnering earlier on. Because that was the difference over the last couple of years, that in the Nordics, especially the stock-listed companies were able to access funding so easily over the last 10 years, whereas on the continent, that capital market isn't really there to the same extent, so they were forced to look for alternative options. Well, alternative options here were always seen as a bit of a weird thing to do. But we see it more and more. But I'll just add to the hope a bit more, because I mean, last year we sat here and we discussed, well, big pharma has so much money, we should expect more M&A. It's not really happening, but now we're really seeing that, and that domino effect leads to specialist investors getting more money back from their investments, that being reinvested. Yes, for the moment it's still a lot of private, but now with Calliditas we also see it public. We were involved in a capital raise for Fleury recently, where they raised more than 500 million for the reverse merger with Index. And okay, that's a very high quality case and very de-risked, but still, when we're speaking to investors now versus other years, our salespeople really get the feeling that, okay, they're open to looking at new cases and making investments. We've seen it with Fleury. We did Braincool rights issue, which was heavily oversubscribed. We did a large block in Ambea last week. So really it's coming back. And now with Calliditas, I think that really helps to generalists also looking at healthcare again, saying, okay, this is something we need to look at again. So I think it really looks much better now, and I think we're really on the way back now.
I'm feeling so optimistic that I almost forget my next question, but it's great. Is that sort of do you think that these types of success cases then in the like the example with Calliditas, does that sort of immediately install more interest in the bigger investor base for this sector, or is it more like a fluke?
No, because I think with specifically Calliditas, a great company, and already last year people were thinking, well, that will probably be taken out, and then after a while the market started thinking, why is it not happening? And now that you see more M&A in the private sector, and now also this deal then potentially happening with Calliditas, and there being a lot of generalist investors in Calliditas, which will potentially have a very nice return on their equity, being more open, we feel that when we have our discussions with specialist investors, but also generalist investors, that they are coming to us like, okay, what other interesting cases are there? So that really leads to, that really does create the domino effect.
And Anu, I'm going to turn to you now to keep fanning the flames of hope. So you were actually almost promising me out in the lobby earlier that Novo is going to do a lot more deals. Maybe I overstep now, but you don't have to promise. But
no,
tell us something.
Great that I felt like I'm being the non-optimist among the group here, and every time contradicted by Søren. So we are optimistic. There is a lot of optimism because, you know, you can see the growth in the pharma sector now. You know, AstraZeneca announced a couple of weeks about the ambition to get to 80 billion in revenue in 2030. I mean, that's a big ambition. That really means they need to fill their pipeline. They need to create more drugs to get out there, which automatically means they are going to be active looking at what's out there in the market. And as you're saying, I mean, pharma is also very keen to engage early and do the deal so that we can, influence and develop the drugs going forward. So the sector is hot and there is a lot of interest. So there is potential. So there is a market out there for these projects coming out of companies. So I think there's a lot of optimism and a lot of growth potential.
Søren, I hope you don't want to contradict that statement.
No, absolutely not. I think there's a lot of optimism, and I'm very sure that Novo Nordisk is going to be buying a lot of companies because they have a lot of money that they need to do something with.
Please don't look at Anu as if he has a big bag of money. But
go talk to him.
Yeah, I'm seeing that this is an interesting discussion, and I like where it's going. But we are running out of time, so I just wanted to, before we part, and we are the only thing standing between these people and lunch, so it's a dangerous position to be in. But lessons learned and best advice. What would you share as your best advice in, say, 30 seconds to any company looking for a partner, looking for investment? Basically, that's what everyone is looking for. So what would you say? What could you give us your best advice, Søren?
30 seconds, wow. So I think my best advice for a company looking for money is to when you go and do it, you do it. We frequently see companies that are sort of testing out, should we be raising money, or come sort of with a half-baked plan, not have thought it sort of from A to Z. And that is I see it frequently, that's why I'm giving the advice. Never ever do that. Venture capital only get measured at 2 different points. One is the number of the returns we give back, very easy to measure. And then everything all the way back to companies coming and seeing us is very difficult to measure. So the only other thing you can measure is from what opportunity space do they find these successes? How many companies comes to see you? So we always want to see you, and we are experts at saying no. And if you don't come super prepared, it becomes very easy to say no. So always, before you go fundraising, have thought through it, have your data room ready, have everything ready. Don't give us the excuse to say no, because we will.
Sounds like a mother when the kid comes asking for ice cream.
How do I follow that? But I'm going to keep it to 30 seconds. So I think today was a really nice theme that Pieter started about knowing your partners. I think you need, as a biotech, when you're ready to think about partnerships, you need to invest into BD, understanding who's out there, who you're going to target, and invest over time about learning about your potential partners and making sure they know you as well. So I think that's a really good message that we can take home from what we've discussed today.
Thank you.
That's because we're over time. The lunch person switched mine off.
We know now who has been talking the most.
Yeah. No, I'll keep it short. Genmab, obviously one of Europe's most successful biotechs, multi-billion-dollar company. Many people don't remember or realize that they've also had 2 near-death experiences. They were down at just a couple of million euro market cap. And their CEO has often said, there's no eureka moment where all of a sudden it clicks. You just need to keep on delivering your data, need to keep on pitching your company, and be open to discussions with partners, and just keep on doing that. And obviously, I'm not promising that everybody will be Genmab, but there are no shortcuts, and just keep on doing it.
So in short, be very prepared, know who you're talking to, and grind. That's the answer. Thank you very much, Søren Lemonius, Balendran, and Pieter van der Meijden for your time. Thank you.